Good. Okay. Dick, now we have the roll call.
I could get the mic on. Well, I don't know. Can I be heard?
Yes.
All right. Richard Beals here, Erwin Breverman. Here. Floyd Kaplan. Floyd, are you here? I guess not. Mitzi Clark.
Okay, yes.
Sydney Fight. Here. Mike Ashkarian.
Excused.
Esther Crystal. Roz Lefker. Here. Phyllis Medvedow.
Here.
Marjorie Prince. Craig Seaman.
Here.
Susie Weisiger.
Here.
May we have the approval of the minutes from the last meeting? Do I hear a motion? Second? Second?
Second.
Thank you. So moved. So moved and seconded. Erwin, are you ready with the financial report?
The resident council.
Dick, can you fix that for Erwin? We're keeping you busy.
Excuse me, the treasurer's report for the resident council budget, there's nothing to report except everything is doing well. People are sending in their requisitions, their invoices, and they're getting paid, and we're within our budget. But I do want to make a comment about the Whitney Center Employee Appreciation Fund, just to let you all know that we're in the last 3 weeks of the drive. It ends on November 1st, and we have sent out reminders to those who have not responded to the drive up till now, and we're hoping that we get 100% participation. And if for some reason you did make a contribution and you get one of these reminders, we really apologize. This work is being done by humans. We could, if it was a computer, we could always blame the computer, but you have to blame us. We tried not to do that, but if we did, we're sorry.
Thank you very much. Your name is? Okay, just an old business. The Residents Council, excuse me, is continuing to get together with new residents, and I'm pleased that we've had a good response from our members, and also a very good response from those that we've met with. Transportation, Ken Sanders. There was a little confusion or misunderstanding of the memo.
Okay. Can everybody hear me? Yes. Okay. Yes, I'll spend a few minutes talking about the memo that I put out last week, because it is important for clarity's sake. So Whitney Center's transportation program is a shared community-wide program. It is not on demand. So I'm going to repeat that again. It's a shared community-wide program. It is not an on-demand program. And so what it requires is a lot of patience, on everybody's part. We've defined our program. It's a Monday through Friday program. It's 8:30 a.m. to 4:30 p.m., Monday through Friday. And we do about 150 or so transports during the month. 90% of those are in New Haven, Hamden, and North Haven. So that's why I say our program is for the greater New Haven and Hamden area. And there's no charge for that. When we go outside this area or outside the program, there will be a charge from the Whitney Center Transportation Program. We have to bring extra resources in. So for instance, and I take full responsibility for this, in years past, we were running evening programs and weekend programs, and I should have been charging actually residents for that. So I'll take full responsibility for that. Now, as we're coming back out of COVID and we're reintroducing our transportation program, it's up to me to make sure that we are following what our contract is to you, the residents. It's providing local scheduled transportation services. And so that's how we've defined it. So right now, we know people are looking for ticketed events and going out to different theaters and all that. We will work with you to try to get you transportation. If it's not our transportation program, we will work with other means. For instance, MyRide. We're in the process of getting applications and seeing if residents want to sign up for MyRide. We can work with residents on Uber or Lyft. Different transportation resources, we will work for you. We're also in the process of hiring more drivers as well, because we know that the residents like it when we take our bus and use our drivers. So we're in the process of trying to hire more drivers as well. So let me pause there right now, because that was really the substance of the memo. And one of the questions was, well, how much will it cost me to get a ride in the evenings or on the weekends to an event? I can't tell you that unless we know the number of people, because it depends on the number of people that go. If it's going to be our transportation services, then we divide the cost amongst the people that go. So I'll pause there. Phyllis, do you want me to take questions on that, or do you want to wait to the end?
No, I can take them now.
What's that?
Take them now. Any questions for Ken now? I'm the only one? Ken, I'm the only one, I think.
All right.
Oh, I'm sorry, I
Yeah,
didn't see your
will
eyes.
you still be driving people who go to the eye doctor, eye care group in Orange? We have a lot of residents who use the different doctors there. There was one day last month that there were 6 appointments for different doctors there.
So thank you. That's a great question. So roughly there's about 5 residents per month that go there. So 5 out of 150. So it's a low percentage that actually go there, but I get it. The residents that go there need to go there. So our service can still go there. We're evaluating it. If it's a drop and go, that's the key behind our transportation program. When we say we're providing transportation to New Hampden, New Haven, and North Haven, it's a drop and go. We drop a resident off, we go around, we might pick somebody up, we might go back and pick them up. So it's a looping type of mechanism. Orange is a little bit more challenging, to be honest with you, to be part of that looping. I'm actually working with Gil on that right now to see if there's a way, because we have a small group of residents that specifically go there. So we're evaluating our transportation program. We won't leave you hanging, just so you know that. We will work with each resident on a resource if we can't do that to get you there. And I promise you that.
I have a
What do you have
question.
here?
In your memo, I know it says, and I'm trying to find the actual place, locations within the New Haven and Hampden areas, you've covered that. Then, oh, I'm sorry, not yours. Then what Maria Freda had sent the memo out, saying that the trip to the museum in New Haven would have a charge attached to it.
So
That's during the week, so it's probably using our own drivers.
So we're looking at it as a drop and go. So if we can do something in New Haven as a drop and go, then we're not going to charge for it. That's the key. It's a drop and it's a go. So it doesn't mean somebody's going to sit there and be with the resident. It's literally a drop and go, because then it can be part of our route. So that that won't be a charge for something in the New Haven area. In fact, there's quite a bit of museums and places in the New Haven area that residents can go to. We can drop and go there. So
Okay.
that wouldn't be a charge.
Thank you very much. Any other questions? Greg?
Yes. Could you give us any order of magnitude of the charge? Say if I go to a concert and I'm the only one and the driver drops me off there, are we talking $5, $50?
So that's a great question. So for instance, we took a look at what an Uber would charge from here to the Cinemark in North Haven, and it's roughly $14 each way to the Cinemark. We also are looking at outside resources. So for instance, the school next door, ACES, actually has a whole transportation program. So we actually work with them and use them as a resource for us as well. So they have a bus, they have a 20-person bus that we can use. It's $225, for instance, to use that bus. That's a drop and a pickup. So for instance, if you had 20 residents go to the Cinemark in that bus, it's $10, roughly $10 each per person, one way, round trip. So that would be another example of what we can do. So we are looking at outside resources to support our transportation efforts as well. And then the coach bus, I know a lot of the residents really want to use a coach bus with a bathroom. I think a 30 passenger coach bus with a bathroom, depends on the trip, but that's like $700 or $800 to use a coach bus in that magnitude. So that gives you sort of a range.
Thank you, Carol.
Yes. This is a follow-up to the question that was asked about the orange, the eye curtain, because I know there are a number of people here who are with the eye curtain. I am with the eye curtain. So the eye care group was originally in Haven, and then it moved out to Orange and Branford. So, and those of us who had positions there, these are long-term positions.
Yeah.
25, 30 years. So I understand that mileage wise,
Can everyone hear Carol?
And the question, I'll repeat it.
Okay.
but that's the end of it. The question I have is, we certainly aren't going to change doctors.
Yeah, no, and I can appreciate that. So the question is, we had doctors, they were originally located in Hampton, New Haven, and they moved out to Orange, they moved out to Branford. And so the residents don't want to change their doctor, they want to continue with their doctor, and they were using the Whitney Center Transportation Program. So the question is, what does that mean for us now? So that was basically along the line what Mrs. Lefker asked. And we will work with each of the, there's not many of you, so we will work with you each on an individual basis to look at how we can handle that for you. An example, for instance, is signing up for a thing called MyRide. A lot of our residents use that, and it's very effective. That's an example. But we will work this, not a lot of the residents that are really in that predicament, so we will work with you on an individual basis.
Any other questions? Let's see if okay, thank you very much. Stay there.
Oh, say that. Oh, the bistro tables.
Placement of walkers in bistro.
Yeah, okay. So the challenge is when residents go into the bistro and there's quite a bit of walkers and wheelchairs, and what do we do with those? We don't really have a separate location that we can just drop them off and have somebody go pick them up. So what we're looking at right now, and I looked at the bistro and I spoke with Thomas about that, is trying to realign the tables a little bit more. So if you go there now, there's sort of 3 different aisles to try to help residents go down into the bistro. So we're evaluating the bistro setup for tables to make it more accessible. We might have to pull some tables out, but we have to evaluate that because you remember, starting Wednesday, we're full opening, so we have to balance the number of residents that go down there, the number of tables that we have. So for now, we're trying to adjust the tables to make it a little bit more accessible, and we're trying to make aisles within the bistro table. So we're doing that right now, and what we're going to do is we're going to just monitor it right now on a daily basis to see how that's going.
Thank you again. Is it unreasonable for us to expect another report next month of the completion of it?
Absolutely, not unreasonable at all.
Good. Thank you very much.
Okay.
Now, before I came into the room, I was handed several sheets of paper. Okay. So, ladies and gentlemen, these are not on the agenda. A notice as a reminder about Hamden's municipal election will take place Tuesday, November 2nd. Anyone can request an absentee ballot this year if they do not wish to go to the polls. Well, pursuant to Senate Bill 1202, COVID-19 may be used as a valid request still for not actually attending in person to vote. send your application, and that will handle, when you get the application, by all means, give it to us, and we'll get it to the town clerks for you. Thank you on that one. Then Jim Hutton would like to make this. Jim, would you like to come up?
Yeah, thank you. I wanted to talk about Veterans Day is coming up on November 11th. And we had plans, or hopefully we're going to have a full schedule of events again this year. That means we have got a program in the CAC here at 3 o'clock. And then we're planning a dinner for the veterans again in the CAC, and a movie in the evening. This year the movie picked is Midway. So it's we have the cost is the posters and the stationery for the invitations and everything. But it's traditionally the Residents Council still donated $500. If we could do that, that'd be fine again. The rest of it we raised from various residents who donated money.
Thank you, Jim. And I'd like to just add to that the Residents Council contributes or pays for the luncheon or whatever the meal is.
Well,
$500 worth.
it goes toward the meal. The meal costs a lot more than that.
Oh.
Well, this year we're going to ask the veterans to pay for their VS, pay something for their VS. It gets a little hard to figure out who a guest is, so that'll be a change. That'll reduce the net cost a little bit.
You'll let us know. You'll let us know. Your mic went off. Thank you, Jim. Okay. Now, Ken, would you like to step again? Ken's going to be up and down for the whole meeting. Ken, would you discuss the Whitney Center Board of Directors Government Relations Committee?
Yes, I will. So, as you recall last month, I had mentioned that Whitney Center formed a government affairs committee at the board level. And again, the committee, as a reminder, the committee was developed so that Whitney Center can have a more proactive approach in dealing with legislative issues and concerns that matter to the interests of Whitney Center at the local, state, and federal level. Two residents, Phyllis Mevidow and Erwin Braverman, are members of that committee. In addition to that committee, we've also established a resident government affairs advisory council to help support the strategic initiatives of the committee by activating our resident associations. So you see, we have 300 or so residents here that can really make a difference in talking to our legislators. So that's really one of the reasons why we want to make sure that we're activating this association. So one of the councils, and I believe Phyllis and Erwin will talk to this a little bit more, but one of the council's first initiatives is to create and distribute a survey to our residents that will help summarize our residents' financial and social impact to the town of Hamden and to the state of Connecticut. Your involvement in the survey will certainly help tell our story. And we talk about financial impact, it's really talking about you going out local, doing some shopping, whether it's at the stores or the barber, the hair salon, et cetera. So I know, Phyllis and Irvin, you're going to talk a little bit more about that? Mm-hmm. Okay, so I'll let you.
A community impact statement is a statement by the Whitney Center basically telling the strong influence that Whitney Center has on the financial wealth of Hamden. From everything that you do when you come to work, everything that you do when you order something online from, say, Amazon, they have to pay tax to Connecticut. That's enriching directly and indirectly the town of Hamden. And it's important when Erwin explains the survey that everyone cooperate with it. It means money in your pockets or less money taken out of your pockets, it might be a better way to say it. If we can cooperate fully, if we can get the legislators to know us, and we know it may take a whole year before we establish rapport with the legislators. And it's a long process of building mutual trust. But when we are establishing that, when we have that trust with them, we can then contact them at any time during the year and say, hi, this is Phyllis. Can we chat for a few minutes? And they likely, in that case, will say, sure, want to come in here, want me to come there. That type of a relationship. But that's essential to what we're trying to do. And in order to get that information about how much we spend, Irwin has written out an excellent survey for us, actually the draft, and we're having another meeting this week of the subcommittee, and we will discuss his draft and add to it or just give him a stamp of okay. Irwin, would you discuss that and add anything to it that I might not have?
So this is a very simple questionnaire and survey. It's basically checking off a bunch of boxes, whether you use various vendors in town, such as going to the salons or the grocery store, et cetera. You're just checking off. And then whether you do that or not. Number two, how often, if you, the ones you check off, how often do you go there? Once a week, twice a week? Just simple number to put in, 1x, 2x, what have you. And then approximately how much do you spend each time? This way, we have an idea of what the financial impact is on the local businesses from the folks who live here at Whitney Center. And so on this survey, which is hopefully it will just be one sheet on both sides, you'll be able to check off the various questions we're asking and how much you spend there. And among the questions would be, actually, if you own an automobile, it's important to know what do you pay in personal taxes for your automobile to the town of Hamden? Do you use a bank? Well, all we want to know is do you use a bank? No financial stuff at all. If you use some services that are outside of Hamden, say in North Haven or Woodbridge or Orange, you can check that off with a simple symbol like O for Orange, W for Woodbridge, et cetera. It's all quite simple. But the idea is to find out what the financial impact we have on the local businesses. There'll be some other questions about, do you vote? Do you vote in local elections, state elections, national elections? We're not asking you how you vote. Do you just vote? And so we're trying to get this information to the folks in Hamden and our local politicians to show that this is a voting block. And number two, we actually contribute a lot to the businesses in this area. We're supporting our neighborhood store, essentially. And so this would be very simple to fill out, just checking it off and putting in some approximate numbers.
I think, let's like to add something. All the information that you give will be anonymous. No one will see them, and your name will not be on the form. So we encourage you to answer the questions, such as it might be income, which on any form I get, I just put not available. On this one, I would answer because no one's going to read it. You have a question?
Yes, actually, I have two questions,
Go right ahead.
but I'll start with the one over here.
There you go.
Yeah,
That'll help.
that does help, yes, yes.
Thank you, Betsy.
I was ready to give something to the fund for the people that work for us.
The Employees Appreciation Fund?
Yes.
We will have a report on that further down.
Well, the question about the report. It's not a question about the report yet. It's a question about the form. The form wants a desk. Wait a minute now.
They really want to check.
He wants a check. That's right. They want a check.
Hold it to your mouth.
Okay. Okay, they want a check. I don't happen to have checks. What do I do? Forget about it?
Cash.
No, come off it.
Cash.
No, I don't run around with that much cash.
Well, how do you pay a bill, if I may ask?
Usually I can put it on my credit card.
Let us find a way and we'll get back to you. May I have your name, please?
Bruce Russet.
Okay. We'll
Okay.
get back to you, Bruce.
Good,
Gladly.
okay. Take a card as most of the country does. Okay, now, I do have a question for our leader. Yeah. Mike, yeah. Are you at all open to getting another shot or a first shot for the COVID? I realize that's a difficult problem, and I'm not want to push you too hard, but I would like a report on that.
Bruce, Peggy Joyce will be giving us a report in just a few minutes.
Oh,
Okay?
okay. From the nursing staff.
And it will be more detailed.
That's
Right.
another problem. The nurse's office is dead today and yesterday. There's nobody there.
Question on the survey?
Oh, who has it?
I do.
Then you gotta wait a minute, okay?
Okay.
Oh, and you'll wait for Peggy Joyce and then ask any other questions, okay? Thank you, Bruce. Another question on the survey.
Yes, if there are two people living in an apartment, do we get two surveys to fill out, or do you have to do it jointly?
2. That's more money.
I think, I think one survey to an apartment, I think the people in the apartment can certainly pool their information. It'll
Okay.
be one less piece of paper that we have to look at.
The writer of the survey prevails. Okay, that's what we'll do.
If they could just, if there's a place to indicate 1 or 2 people in the apartment, that would be very helpful.
Oh, that's a very good suggestion. We will have
Good.
one more line that you can check off, namely, this is a report from, a survey response from 1 person or 2 people. And that would be, yeah, thank you.
Thank you. Okay, Greg? Greg? Okay. Ken, want to stand up again? Would you give us a report on the safety fair, October 28th?
Sure, I'd be very happy to. So the staff and the residents, we have a safety committee. Phyllis and Mrs. Greenbaum and Dr. Kashkarian, and there's 1 or 2 other residents. I'm drawing a blank on their name. Who's on that?
Andres
Andres.
report, Roberts.
Yeah, Therese Roberts is on that committee as well, along with staff, myself, Peggy, Emily, and Kaylee have been meeting quite regularly to talk about our safety fair. So it's going to be October 28th. It's going to be from 11 a.m. to 1 p.m. And we're going to have about 10 different topics at that safety fair. And I'll tell you what they're going to be right now as a teaser. So we're going to have apartment safety, and we're going to talk about scatter rugs, electrical safety, fire safety in your apartment, bathroom safety. We're going to talk about food safety. We're going to talk about fire safety outside your apartment. We're going to talk about adverse weather protocols. We're going to talk about power loss. We're going to talk about infection control. There's going to be another performance with Dr. Kashkarian washing his hands, if those of you remember from a couple of years ago. We're going to have Apex in here for medication management. We're going to have our rehab department for fall prevention. We're going to have our clinical services talking about medical emergencies. Raphael is going to do something on cyber safety, and we're going to have a bunch of takeaways for all of you. So we're really looking forward to this event. The town meeting will be abbreviated. We're going to go from about 10:30 to 11, and then we're going to go right into our safety fair.
Thank you very much, Ken. Any questions? Okay. We've been having this report that's coming up now, the trolley committee, for several months. And after each meeting, we get telephone calls, really, what's going on? Susie has a report.
No, actually, Ken has the report.
Want Ken to give it? Okay, Ken?
I guess we're playing tag. I'm it. Okay, so so we have been talking about this trolley or indoor transportation for quite a while, and just as a reminder, and I think it's really important to remind people why we've stopped using our existing trolleys. And the reason why we stopped using our existing trolleys is really they were not safe for our community. We actually bought those trolleys a long time ago, a number of years ago, and they were special. And why were they special? Because they were able to go from our south desk to our north desk, and they were thin enough that they can maneuver through some of our narrow hallways. And we realized that these ones were not safe. They weren't dignified. And there were two issues. Was one issue, and the other issue was really trying to find drivers for the trolley. We were relying on some volunteers that are no longer here. We were relying a lot on staff, and we were relying on residents. And so we, at this point in time, for the old trolleys anyways, they were so unsafe that we didn't want residents to drive them anymore. Our staff, we don't have the staff right now. We're not staffed really to be driving the trolleys as often as the residents would like us to. So we do really need to look at two things. We need to look at a new indoor transportation system, and we need to really get a better handle on who's going to be driving this new indoor transportation system. The first thing, working with an ad hoc committee of residents, we determined that we don't need a thin vehicle to go from the south building to the north building. The residents in this ad hoc committee said, listen, what we really need is a vehicle to go from the south desk to the bistro and back. So basically just up and down Main Street. With that new set of parameters, it has opened up some options for us. And so I'm pleased to tell you that I've been working with a company, and we are outfitting a golf cart right now to be that's safer than our last one, that will make it easier for residents to get on and off of this golf cart. I spoke with a gentleman on Friday, and it looks like by the end of this month or beginning of November, we'll be able to test drive it here just to see how it works in our community. So phase one is it looks promising that we have a vehicle. Phase two, or part two of this, is really the driver aspect of it. Because you see, we don't have our staff readily available to be driving this. We are evaluating and trying to get more volunteers here, but that will take some time. The third option, which we originally talked about, which I didn't like and didn't want, were residents to drive this golf vehicle. However, being that this could be a lot safer vehicle for residents to get onto, we're going to reevaluate once we get it here if there's an opportunity for some of our residents to volunteer and drive this golf cart. I will tell you, it's just not going to be, oh yeah, I'm going to drive it. There's going to be some lessons. There's going to be some test driving. Peggy will be part of it with probably Robert or our rehab to make sure that people are actually licensed to drive this. And if we do go that way, we'll develop a license for that because it's really important. The safety aspect of it is very, very important to us. So the long and the short of it, it looks like we're looking at a new type of indoor transport. The driving aspect of it could take some time, but we will evaluate the residents as the ability to drive this new indoor transport.
What's the capacity?
It will be a driver plus 3 others.
Plus 3 others.
Drivers plus 3 others.
A volunteer driver, if anything were to happen to the passengers en route, what kind of coverage would that driver have regarding lawsuits?
It would, my guess is, I can confirm this, would fall under our insurance that we have right. Yeah, yeah.
It's
It-
under our general liability and property insurance.
You sure of that?
Yes. Yeah, any volunteering that,
No, sorry, go ahead.
any volunteering that you do currently as a resident, if you or someone else gets hurt in that process, it's covered under our general liability and property liability.
Carol?
I'm going to go back to 2013. And man named Zimmerman was head of the House and Grounds. And he gave me an assignment. Would I please go down to the North Living Room and see what we could do so that people from the North Building and the South Building could get together? Please remember, we had no seating area in the South Building. We had an art area, but there was really no, very tiny seating area. Okay, so I went down there and I looked around and I saw how they were using sofa pillows behind them to make themselves comfortable and that sort of thing. I asked Eve Zimmerman to come down later, and then I also asked Trudy Bollier. And we knew what we had to do as far as upholstery. We had to get back pillows because they were literally taking sofa pillows. Now, you may wonder why I'm talking about this. What happened after that? People were still reading. It was still a little messy, but we started tea and cookies because that was essential, as it turns out, to get a merger between the two buildings. Because quite honestly, there was a feeling of, we're not so sure we want the North Building wasn't too happy with, they thought it was going to be a fancy thing, right? They didn't realize the schlep we'd have to get down there anyway. Okay, so now here we are. Now we got to a place where people had their walkers, and they learned to bring their walkers and park them in a place, you know, there weren't that many, but there were walkers, and serve themselves. And we ran into the problem about the walkers in the bistro and cutting across and all of that. We're now back to 2013. What are we going to do to make it easy, really easy? Drop them off at the bistro? They have to eat. They want to go to a movie. They want to meet with their friends. Why are we not continuing to have constant? I'll go for the driver. I understand that we don't have the availability now. But I have called, I can't tell you how many communities such as ours with friends that I have around, and they take away in the bistro. If you can't manage to, they don't allow the clutter. Somebody takes it from you, whether it's a volunteer or a staff member. I don't know. I know they have a staff, but they're not going to tell me. Maybe they're volunteers that do that. Now we're coming and we want to stop at the bistro. We want to stop at the bistro. The center stage is there. Sure, it's around the corner. What about if you want to go to the pub? We're advertising pub meals all the time. How do we get to socialize? I think socialization is the key in this at this time of our lives.
Carol, can we have Ken answer that?
What?
Can we have Carol answer?
She wanted me to answer that for you. You know, Mrs. Greenbaum, I hear you, and we know socialization is critically important. But I will tell you, there's multiple ways that people can socialize, quite frankly. There's socialization at the bistro, there's socialization at the CAC, there's at the dining venues. We heard predominantly loud and clear that people really want to this allows people to get to the bistro and to center stage. We're not going to solve a problem for every single resident. One solution is not going to solve a problem for every single resident. I'm sorry, we're not. We continue to try different options, and this is an option in speaking with this committee that they felt that this would help quite a bit, actually. This one thing would help quite a bit. And
Thank you.
so we're starting down that path of helping one bit at a time. I don't have an answer for you in terms of, we can't find something that's going to take us through from the south desk to the pub, quite frankly, without bumping into the walls, bumping into people. We can't find it. It's not available. We can't find it. We did
There's
talk
no
about.
such word as can't.
No, we can.
Carol.
Well, here's the deal. There is
Carol,
something
let's
out
listen.
there. It
Excuse me.
doesn't.
I know
Carol,
I
Carol,
know I'm being argumentative.
Carol,
Yes,
let's
sorry.
listen to what Ken's
I'm
saying.
sorry.
So
that
the-
was
so-
rude of me.
So the other option, quite frankly, we put on the table was that we could have a vehicle to go from the south desk outside and drop off at the north side. So that was an option that we contemplated as well. And you're shaking your head no. I'm just saying. So we did talk about we did talk about various options. So for now, I'll say for now, this is something that we've come up with. You're right. We should never say never. But for now, this is an option that we've come up with that we feel that we're moving the community forward. And that's what has been our task. Okay, so it's for now, this is what we're going to do. We'll never say never. You're correct. We shouldn't do that.
No,
Thank
but
you
you can
very
say
much,
never,
Ken.
but you can't say can't.
Yeah, well,
Good. Thank you very much. And Carol, thank you. And who, I'm sorry. Oh, I didn't see, Chris, I didn't see you.
Add one thing. I just would like to add one thing, and that is I want you to reconsider going from the north to the CAC. A lot of our residents in the north building are older and they have difficulty coming down here for events. You're only going one way. I want you to reconsider and include going the other way somehow.
so just to be clear, the vehicle is meant right now to go up and down Main Street. It goes from the south desk to the bistro and back. The committee felt that for now that would work. It's not perfect, but it would work. The reason why we can't go from the north desk to the CAC is because of the narrow hallways. We just don't have the right vehicle right now to do that. That's the reason why.
Thank you, Ken.
Okay.
And now, still on COVID, Peggy Joyce. Among other things, Peggy.
So I'll start with the real positive news first. You're all getting a memo today that will let you know that we're starting with flu vaccines on Wednesday. So if you live in the north building, your vaccination day will be Wednesday between 9:30 and 2. And if you live in the south building, it'll be Thursday between 9:30 and 2 this week, in 2 days. No worries, if you have plans for those days I just mentioned, we will accommodate you. Friday from 10 to 12, the Wellness Center will be open for anyone that missed their date on Wednesday and Thursday. And then we'll continue next week in the Wellness Center offering those flu vaccines to anybody that missed it. Our goal is to get you all vaccinated, so we'll make sure we do that. If you've already gotten your vaccine, if you could call the community nursing office, on the memo, their phone number is listed. Let them know that you've already received it because we do account for 100% of the residents on the campus. Correct. So that's the flu for this week. Starting next week, the flu shots will be this week. Starting next week, we're going to start giving the third dose of the COVID vaccine. So you can give them together. I did poll a few residents to see what the general thought was. Most people didn't want them together. So that's why we are spacing them out. So starting the week after, we will be here in the Cultural Arts Center in the living room, just like last time, administering those COVID shots to all of you. It's very timely. You don't need to run out and get them because you have to wait another week. They say 8 months is kind of perfect timing. There is some research that says you start to diminish having the effectiveness after 6 months, but 8 months is still a good time. Most of you got your second shot on February 13th. So we're right in the ballpark. So we're doing well. We will probably be doing our own COVID vaccines this year. The nursing staff have offered to help us out getting that done. I don't want to wait for the pharmacy. They said they can help, but we're on a wait list, and I don't want to take that chance of when that wait list will show Whitney Center as having the vaccines being distributed.
Any questions for Chris?
Yeah.
For
When
Peggy?
was the North Building going to get
Chris is
When-
next.
flu vaccine?
So Wednesday is the north, Thursday is the south. But again, it'll all be spelled out on the memo. I am breaking you up by floors too, so that we don't have everybody come down at 9:30 because I'm trying to minimize the wait. So again, depending on what floor you live in each of those buildings, you'll be designated a time for the vaccine administration. If you know people here in the campus that cannot get to the clinics, we will come to the apartments. So we will reach out, the liaisons and nursing know who those people are, and we will go directly to the apartments to make sure we inoculate everyone.
Thank you so very, very much for the good news.
Yeah, we're
And
excited.
that is good news.
It is good news. So I'm sure all of you know the CDC has said anybody over the age of 65 should get the booster. The younger folk, if they have any kind of underlying condition, should get it, but it's not required. So our staff, it will be optional. If they'd like that third booster, we will be offering it to them as well. But it is not mandatory for the healthy adult. And then just an update on COVID. We currently have no one in the campus, both team members and residents that have COVID. So we've been very good. The team, we've gone now several months without team members becoming infected. So I'm happy to announce that as well.
Peggy, any change in the percentage of staff
Yeah,
inoculations?
We're at 98% and we're holding really steady at that number. New hires, before they even come in, we're talking to them about their vaccination status. So we have a good handle on who's coming in vaccinated. Those that are not, we're offering them to get the vaccine. Or again, we still have to give the medical or religious exemption to anyone that would like to apply for that. But we're holding very strong at 98%.
Does anyone have any questions? I think, Greg.
I understand that there were some COVID deaths last week.
Yes.
Is it known how they were infected?
Yes. So we did have a resident that became infected by her private caregiver, who I will add, I'm not supposed to divulge vaccination status, but she was fully vaccinated. And unfortunately, that's the only link that we have to the resident becoming COVID positive. The same person that lived in the apartment with her also became COVID positive. And what we see, even amongst our team members, if someone comes and they've been exposed by a family, it's very hard not to have it spread within a very small nucleus family. So we were anticipating the second person probably becoming positive, and unfortunately she did, and they did both pass away. COVID is the Delta variant. That's why we take things so seriously and we try to follow all our protocols, because once you get it, as you increase in age, it's very hard to fight, especially if you have comorbidities, if you have medical conditions, it's hard to fight it because it's so deadly.
Thank you, Peggy. I don't think anyone in the audience would mind if I again thanked Peggy and her staff for the wonderful job they're doing. Bringing it up to 98% is great. Thank you, Peggy. Chris Johnson, are you ready to give us a report on the nominating committee? Chris is the chair.
I have quite a lot to say, so I'll go up and
Beth.
So I wanted, this is a preliminary report on the nominating committee because you have until Friday to get your form in, you know, the form where you can recommend people. So I'm just giving you the preliminary report. The nominating committee is comprised of the following residents: Batya Astrakhan, Ralph Franklin, Carol Wilson, and myself, Chris Johnson. Evelyn Krevlin was a member of the committee through the first step until she accepted a position as a nominee. Up to this time, we have asked 34 residents if they would accept a nomination for a position on the Residents' Council for the year 2022-23. 3 current members of the Residents' Council have said they will run for a second term. 7 additional residents have said yes, they will run. That's 7 out of 34. The 10 candidates are listed below. I just want to give you the names because if you have additional people you would like to nominate, you can nominate them on that form and get them to us. The 10 candidates that we have so far are wonderful candidates, by the way: Lucy Ambach, Floyd Kaplan, Kai Erickson, Steve Gurney, Lynn Hawkins, Jerry Hesse, John Jones, Roz Lefker, Van Selden, and Susie Weisinger. The closing date for nominations is Friday, as I've said, October 15th. All residents may nominate other residents up to that time. They must ask the individual if they wish to be nominated. I'm getting some forms where people are nominated without a statement that they've been asked. After that date, the nominating committee will develop a list of nominees which will be posted on the bulletin boards. The nominating committee will accept any petition signed by 20 residents suggesting a resident who has not been chosen through the regular process, but who is willing to serve. Their names will be added to the final slate presented to the residents. So on November 10th, there'll be a campaign party here in the CAC to introduce the candidates who will speak briefly. The voting ballots will be distributed some days afterwards. Each resident will be asked to vote for up to 6 of the nominees listed. The ballot should be returned by the deadline stated on the form, and then the teller committee will then count the ballots. The results will be announced at the Residents Association annual meeting scheduled for December 16th. So you have some time to nominate people, some time to think about who you wish to vote for, and I hope you all vote. Thank you.
Thank you, Chris. Dining committee chair is Esther Crystal. Esther, may we hear from you, please?
Well, good news from the dining committee. There's been a lot going on, and tomorrow is the big day for the opening. So what I'd like to do is to try to simplify what's going to happen. So I'm going to start by the bistro. The bistro, starting Wednesday, is going to be open all day from 7:30 to 7 o'clock at night, 7 days a week. So that's easy to remember. It's opening all the time. During that time, there are going to be meals at different times. And in between, you can get coffee or tea or some pastry, but it's going to be open all the time. A little more complicated gets into the Fireside Pub. That's open 6 days a week. They're not going to be open on Mondays, but that's simple. Just 1 day a week that they're not going to be opened. Now, when we say 7 days a week, On Saturday, there's going to be, instead of a regular meal, now the bistro's going to be open from 4 o'clock like it always is. So during that time, between 4 and 8, there'll be appetizer dishes that you can purchase or use points for. So that is going to be like a little meal. You can have shrimp, cheese and crackers, and things like that. And on Sunday, there's going to be some kind of a buffet. But that's during the hours they're open, from 5 to 7, as when they would be serving meals. So that's simple. Now we've got 2 venues thought about. Then there's the center stage. The center stage is going to be open 6 days a week, but it's only going to be closed on Sunday. It'll be open from 5 until 7. Now, to get to center stage, you need to have a reservation, and the reservations are going to continue as they were, 5 o'clock, 5:45, 6:30. Now, if you don't have a reservation and you want to go into center stage to eat, community tables are going to be opened up. And those are, this is some place to go without a reservation, at 5 and at 6:30. Now, if you go to a community table, this means that you come in without a reservation and you sit at the table and you order when you arrive. This is not a table where you invite people to come and you wait for them. This is a table where you come individually, enjoy other people's company, and you order and you eat right then. The other venue for food is the corner store. That's open 6 days a week. That's going to be closed on Sunday. So they're open Monday through Friday from 7 to 4. And this is new. On Saturday, they're going to be open from 10 to 2. So that's just Saturday morning. This is where, if you purchase items, you can't use points for them. Now, because of these 4 openings, we do not have the staff to deliver any meals to the rooms. Maybe in the future we can do that, but we can't do it now.
Excuse me, Esther.
So,
What about the sick people?
well, the what?
People who are sick.
The other, I'm getting to that. Those people who cannot physically make it out of their apartments, there would have to be a notice from the health services or the liaison in order to get a meal delivered to the apartment, and there is no charge for that. So that is the only way that you can get out of that. There are no meals delivery from center stage anywhere. In the bistro, you can order food, but you have to pick it up, or if you have an aide, the aide picks it up. But there is no delivery except for the exceptions that I mentioned. So I'm going to go on to something else because last week, Ken Sandberg and Thomas Hudson and myself on Wednesday and Thursday. On Wednesday, we spent 4 hours, and on Thursday, 2 hours, with residents who signed up in order to bring up their issues that they had with the dining services. So we figured we'd get about 90 people. Well, we didn't. We got 28 people. They brought up very important issues. And I know people talk to me in the hall, they ask this question or that question, and they even call me on the telephone, and I'm happy to answer those questions. But I was surprised when we gave people an opportunity to do this, it didn't happen. Well, we worked with what we had, and I want to just briefly report on this because we did send out surveys relating to this and sign-up sheets. Thomas Hudson's going to give a written statement about the results, but before then, I'm just going to mention very briefly. I'll start with talking about alcohol. Alcohol can be brought to the center stage, but it is really frowned upon. It's not a good thing. You can bring no alcohol to the pub at any time. And there are 4 tiers of the kind of drinks that are served. On the lowest tier, which would be like the house wine, that lower tier can be purchased using points. All the other areas of alcohol that you purchase, you have to pay cash for, cash to the room. There are residents that are saying that they are getting itemized statements from our finance department. This is something that a number of us want to have regularly. These statements that they're getting are only for the month, that month. So if they want itemized statements the next month, they have to call again. But some people are doing that. The other thing is the acquaintance of the wait staff in relation to the food that they serve. We would expect them to know something about what's in the food. For instance, if they're getting a muffin from the case in the bistro, we would like them to know if it's a blueberry or just cinnamon and sugar. We need to know that. Residents have asked for some dessert in the pub and the bistro, and people want to have ice cream. Thomas is pursuing this issue because so many people wanted it. And we're thinking of having ice cream in cups, which would not require any labor. So that may be coming up. The kiosks have been a problem. They're out of date. It is better not to have anything on the kiosk unless it's up to date, because it got to be quite confusing. I know that at your north and south desks, you have the folder there, the loose leaf folder, and you've got the bistro and the pub there. You don't have the center stage menus. And that is something that I have been pursuing diligently. But you'll get it. The reservations are going to be allowed that week that you're going to eat. In other words, there's no way, let's say, if you're going to eat on a Tuesday, you have to call in on a Thursday or Friday the week before. Forget the 3-day ahead rule. You can call in any time beginning Sunday of the week that you're going to be eating. When you're making a reservation for dinner at center stage, please mention that you want to be called back. Personally, I think everyone should be called back to confirm if they really have an appointment at a certain time when you call in for a reservation. But if nobody's there, and by the way, somebody's usually there first thing in the morning, so you can get them. But a little later in the day, there's not enough help to have someone sit there all day at the telephone. Please say you want to be called back, and you will be called back. I've talked to Lynn about this, and she regularly checks back, even up to the last minute during that day. I just want to mention one thing about canes for people who are new to Whitney Center. I've been finding people eating and having their canes lying on the floor. That's a big no-no here because we are trying to avoid accidents. So there are little containers in center stage, in the bistro, in the pub, and they're little black containers, and that's where the canes go. So I think that's it, unless I have any questions.
Excellent report, Esther. Thank you. Are there questions? What? We've got a question in the back.
Is there a plan to restore the pub to full service 7 days a week with a real menu?
Excuse me? You are interested in having
Having the pub restored to 7-day service with a full dinner menu.
I'll tell you what, there's a little history about that, and that's a very good question. Earlier on, before I came, there was no food, meals served in the pub. And what had happened is the residents really pursued the management and said, we want some meals served in the pub. Regular meals, not just the ones that are serving now. They wanted to have full meals. And so full meals were served on limited options. That was not a good thing because the chefs were unhappy because by the time the meals were served into the pub, much of the time they were not warm and it didn't work out well. And so what they are doing now is to have these meals that we have every day except Monday that are served buffet. And there are only a few instances where people have said that the food is not hot. It may be warm because there are warming trays there. But full meals are not going to be served in the pub.
You said about alcohol in the pub and in the center stage. You didn't mention the bistro and alcohol.
I think you can't order alcohol at this time in the bistro because that would take labor to someone to go and get it at this time.
What if you bring your own?
No one's going to stop you from doing that.
Just don't get too drunk, because it's my name on the license.
Dini? Dini? Okay.
I like what's going on. You're getting things moving, and that's good. And I think it makes sense, except for one thing.
Okay.
There will be an insurrection here if you serve Dixie cups instead of real ice cream.
Wait, I'm sorry, I don't know the difference. The Dixie cup is something that is pre-purchased. You would like to have our own ice cream put in the cup? Tell me what you mean. Pardon?
We don't want prepackaged desserts. It's like a cafeteria.
But if this would have to be in some way prepackaged. We're trying to avoid labor to be involved with the distribution of the ice cream. But we can get good Dixie cups. I'm not familiar with Dixie cups, so I can't comment on it. But there has to be some prepackaged ways to do this.
Esther, you can bring that back to the dining committee.
Oh, I certainly will.
My comment is that the quality of the ice cream that was in the box stickers that were delivered, that were Dixie cups, was very poor quality. And I think that's what you.
Oh, I see. Okay. So I will bring that up because I have purchased at the farm prepackaged ice cream and it was delicious. So it's the quality of it. I see. I agree with you. I think that's very important.
Thank you again, Esther and Dick.
Okay.
Thank you. Okay, then we go to Bitsy Clark for the Employees Appreciation Program. Which was just one of your questions.
Did you ask me to make a report?
Yes, I did.
Well, first of all, I want to say an enormous thank you to all of you that have given so generously to the Whitney Center Employee Appreciation Fund. It's very, very exciting and heartening to go down and pick out those envelopes like Sydney does, and then send them to Irwin to deposit in the bank, and then to me to write thank you notes. It's wonderful to see how many of you feel strong enough to give so generously. Now, this year, we've always just sent out one in the fall, and one in the spring, one in the fall, so people could divide it up or pay just at one, or donate just once, or can divide their donation. But this year, we decided, because we discovered that we had about 60 people that we hadn't heard from, so we decided to send out a reminder. And we're just about now to go through and pick those up. Is that right, Sydney? Yeah, and we're very excited about that because we're going to hopefully come very close to 100% of the people giving to the Whitney Center Employee Appreciation Fund. But Floyd Kaplan and Sydney Fight and Irwin Braverman and me are the ones that work on this. And I have to say, we have a lot of fun doing it. So thank you so much for being generous. And if you've gotten a reminder, we hope you'll give. If you haven't given yet, we hope you'll give now. Thank you.
Thank you very much, Bitsy. Any questions for Bitsy? Okay. Next report will be about our transportation for trips. You know, when the trip committee had met, we had all been called by many people, as all of you have been asking questions about, when are we going to have a trip? And we finally got our committee together, and we came up with a list last Wednesday. No, oh, I'm sorry. That isn't working now?
Battery might be dying. Try it again, it's not usually.
Okay, is that all right now? Yeah. Okay, I'll come closer too if I can. The committee had expected so many people to come down and register on that Monday and that Wednesday. We thought we'd get maybe 80, 90 people. Well, approximately 30 people signed up. A very, very small number. We're going to have another sign-up sheet on Wednesday from 11 to 1 in the bistro. And I have to be very honest and blunt about something. If the residents don't want these trips, we won't offer them. They take a lot of work, a lot of planning, and a lot of excitement about it. We're giving everyone another chance on Wednesday to sign up again. The two places that we're discussing now will be a trip to the Knights of Columbus Museum and also to fill up the I'm trying to find out the name of the theater in Branford.
The Legacy Theater in Stony Creek, where several of the residents had gone to see
Thank you.
So, and you're absolutely right, Phyllis. There was a request.
Marie, do you want to come up and,
Yeah.
because it's being filmed?
You can walk.
Yes.
Grab a microphone.
Hi, thank you. There we go. Hi, and thank you so much to the members of the TRIP committee, to Evelyn Krevelin, Roz Lefker, and Phyllis. Because of many of the residents and their motivation, we were excited about putting the trips together. We were really eager to do so. And we took your survey when we had the interest table, and we were onto 2 pages of so many places to go. And then the TRIP committee met, and thinking in terms of the interest and location, we decided that the Legacy Theater, which is in Stony Creek, a lovely small theater, which was considered, especially because of COVID, their guidelines are very strict, and those residents who did attend felt very comfortable. So when we heard that the Christmas Carol was being offered, that was one of the top choices. The Knights of Columbus Museum also is offering their holiday, The Majesty of Creches from around the world. And it's also a wonderful museum about the history of not only the founding of the Knights of Columbus by Father McGivney, but also the local history of New Haven. And we also had put together the trip to Florence Griswold. It's a lovely, we got a great response for that. It's a lovely trip, including lunch, which you pay for, but they have reserved seating for us for an 11:30 lunch. And of course, too, there was a lot of excitement about going to the Bronx, to the New York Botanical Gardens. And that was going to be organized in collaboration with Mount Carmel Tours. And as you know, it does require a commitment. As Ken said, a coach bus, a very luxurious coach bus, with a restroom has become more expensive than maybe some of you might remember. So that was a cost of $203 for the luxury bus, the luxury of having a restroom, admission to the Bronx Botanical Gardens, the trolley train ride, as well as a buffet lunch in the Botanical Gardens cafe. So it was full, and it's door to door. So when you equate the price of doing anything going into New York, that price is fairly reasonable. But it does require at least a minimum of 30 people to justify the cost. So unfortunately, the December 7th date has been filled. So we are putting that back on the docket for perhaps a trip in January. And then if any of you decide, okay, listen, maybe going to New York and the holiday show, the train show is not what we'd like to see, then again, if you're interested and you'd like to visit the Botanical Gardens in the spring, please let me know. And there was also talk about wanting to go to the Tenement Museum as well. So we are, eager, as I said, to get you, the residents, those who are here and those who aren't, back on the road again. So just come by and see me and some of the members of the TRIP committee on Wednesday from 11 to 1.
Thank you very much, Maria. Any questions for Maria? Okay, Bruce, have we answered your questions?
I think you have.
Okay. I'll make sure that you're happy with that. Are any other questions from residents? Jim?
Do you need a motion for the $500 for the Veterans Day?
That's yours. You don't vote on that every year. Okay, the next Residents' Council meeting is November 8th. I'm sorry, I couldn't see you.
Yes, a question for Peggy Joyce. Last town meeting, you talked about residents in memory care. I was curious, what is the capacity of the memory care section?
The capacity up on our memory unit is 14.
I believe you said there were 12 people there and
Correct.
12 in the waiting list. two of those rooms not available?
Yeah, so we do give people some time when they transition off that unit. Either they move to the health center or by death. So the families do have up to 30 days or so to vacate. So that takes a little bit of time.
Sure.
And sometimes, you might have a spouse that you're thinking of moving up on the memory support. We keep people on the wait list, but then the name might come up to the top, but you're not ready to make that move. And we still keep you at the top so that you don't go back down to the bottom. So a lot of times, even though they're on the list, the resident family, resident spouse might not take that opening at that particular time. And they just wait till a future date.
Very good.
Thank you, Peggy.
I have one other question.
Okay.
The CDC is recommending that CO2 levels be at 800 parts per million or less as an indication of how good the ventilation is. Does Whitney Center measure CO2 levels in various places in the building?
Assuming we can get back to you on the answer, I know that we do air quality testing on a regular basis, whether it's CO2 specific or not, I don't know. But we do it as part of our air balancing for our HVAC system. So I'll find out and we can answer that at the town meeting.
Any other questions? The next town committee meeting, and check me if I have the correct date, November 18th?
October 28th. That's going to be the safety fair. We're going to do an abbreviated town meeting and then go right into the safety fair.
Thank you, I should have known that. And I urge everyone to please go to the town committee meeting, and then I urge you to please go back for the safety committee fair. When we had it 2 years ago before COVID, it was so well attended, and we had the request to do it again, and we are doing it again. So that please attend. It's important for you to learn these things, and it's important for us to have you show up. Thank you very much. I have a motion for adjourning the meeting.
So moved.
Second?
Second.
Meeting's adjourned. Thank you for coming.